Attention Deficit Hyperactivity Disorder, ADHD, is a neurodevelopmental disorder that affects millions of people worldwide. ADHD is characterized by inattention, hyperactivity, and impulsivity. These symptoms can make it difficult for people with ADHD to focus and complete tasks, which can negatively impact their daily lives. While there are many treatment options available for ADHD, one of the most commonly prescribed medications is Ritalin. In this video, we will explore the uses and dosage of Ritalin for the treatment of ADHD, as well as some of the potential side effects and precautions that should be taken when using this medication. What is ADHD? ADHD is a neurodevelopmental disorder that affects both children and adults. The disorder is characterized by symptoms such as inattention, hyperactivity, and impulsivity. People with ADHD often have difficulty focusing on tasks, remaining organized, and completing tasks on time. These symptoms can interfere with daily life activities such as school, work, and relationships. ADHD is believed to be caused by a combination of genetic and environmental factors, and can be diagnosed by a healthcare professional. How does Ritalin work? Ritalin is a stimulant medication that works by increasing the levels of dopamine in the brain. Dopamine is a neurotransmitter that is responsible for regulating attention, motivation, and pleasure. By increasing dopamine levels, Ritalin can help improve focus and attention in people with ADHD. Ritalin is available in both short-acting and long-acting formulations, and can be taken orally or as a transdermal patch. Ritalin is often used as part of a comprehensive treatment plan for ADHD, which may include behavioral therapy, lifestyle changes, and other medications. While Ritalin can be effective in managing ADHD symptoms, it is important to understand the potential side effects and risks associated with this medication. Benefits and side effects of Ritalin. Ritalin can be an effective medication for managing ADHD symptoms in both children and adults. Some of the benefits of Ritalin include improved focus, increased attention, and reduced hyperactivity and impulsivity. However, like all medications, Ritalin can also cause side effects. Some of the common side effects of Ritalin include headaches, stomach pain, loss of appetite, and trouble sleeping. More serious side effects can include heart palpitations, high blood pressure, and seizures. It is important to talk to your healthcare provider if you experience any side effects while taking Ritalin. Different types of Ritalin and their dosages. Ritalin is available in several different formulations, including short-acting, intermediate-acting, and long-acting formulations. The dosage of Ritalin will depend on several factors, including age, weight, and severity of symptoms. Children with ADHD are typically started on a lower dose of Ritalin and gradually increased over time. The dosages for Ritalin can vary depending on the formulation. For example, the starting dose for short-acting Ritalin is typically 5 mg to 10 mg, taken 2 to 3 times per day. The starting dose for long-acting Ritalin is typically 20 mg to 30 mg, taken once per day. It is important to follow your healthcare provider's instructions when taking Ritalin. Taking too much Ritalin can cause serious side effects, while taking too little may not effectively manage ADHD symptoms. Who should take Ritalin? Ritalin is typically prescribed to individuals with ADHD who are 6 years of age or older. Ritalin may be prescribed to individuals who have tried other medications for ADHD, or who have not responded to other treatments such as behavioral therapy. Ritalin is not recommended for individuals who have a history of drug abuse, high blood pressure, heart disease, or glaucoma. It is important to talk to your healthcare provider about any medical conditions you have before taking Ritalin. Precautions and interactions with other medications. Ritalin can interact with other medications, including some antidepressants and blood pressure medications. It is important to tell your healthcare provider about any medications you are taking before starting Ritalin. Ritalin can also be habit-forming, especially when taken in high doses or for prolonged periods of time. It is important to follow your healthcare provider's instructions when taking Ritalin to avoid the risk of addiction. Ritalin versus other ADHD medications. There are several other medications available for the treatment of ADHD, including other stimulant medications and non-stimulant medications. While Ritalin is an effective medication for managing ADHD symptoms, it may not be the best choice for everyone. Your healthcare provider can help you determine which medication is best for you based on your individual needs and medical history. It is important to work closely with your healthcare provider to find the right medication and dosage for your ADHD symptoms. Alternative medications to consider: Adderall. Adderall is another commonly prescribed stimulant medication for ADHD. It contains a combination of amphetamine salts that work by increasing the levels of certain chemicals in the brain. Adderall may be considered as an alternative to Ritalin for individuals who experience inadequate response or adverse effects with Ritalin. Vyvanse. Vyvanse is a long-acting stimulant medication that contains lisdexamfetamine. It is converted in the body to dextroamphetamine, a central nervous system stimulant. Vyvanse provides sustained symptom control throughout the day and may be an alternative option for individuals who prefer a once-daily dosing regimen. Concerta. Concerta is an extended-release formulation of methylphenidate, the active ingredient in Ritalin. It is designed to provide a gradual release of the medication, providing symptom control for up to 12 hours. Concerta may be considered as an alternative to Ritalin for individuals who require longer-lasting symptom control. Strattera. Strattera is a non-stimulant medication approved for the treatment of ADHD. It works by increasing the levels of norepinephrine in the brain. Strattera may be considered as an alternative to Ritalin for individuals who prefer a non-stimulant option or who experience intolerable side effects with stimulant medications. Intuniv. Intuniv is an extended-release formulation of guanfacine, a medication that works by stimulating certain receptors in the brain. It is approved for the treatment of ADHD and can be used alone or in combination with other ADHD medications. Intuniv may be considered as an alternative to Ritalin, particularly for individuals who have comorbid conditions or require additional symptom control. Tips for taking Ritalin. Taking Ritalin can be an effective way to manage ADHD symptoms, but it is important to take the medication as directed. Here are some tips for taking Ritalin. Take Ritalin at the same time each day. Do not crush or chew Ritalin tablets. Avoid taking Ritalin too close to bedtime, as it may cause trouble sleeping. Talk to your healthcare provider if you experience any side effects while taking Ritalin. Conclusion. Ritalin is a commonly prescribed medication for the treatment of ADHD. While Ritalin can be an effective way to manage ADHD symptoms, it is important to understand the potential side effects and risks associated with this medication. By working closely with your healthcare provider and following their instructions, you can effectively manage your ADHD symptoms with Ritalin. If you have any questions or concerns about Ritalin or ADHD, talk to your healthcare provider. While Ritalin is an effective medication for managing the symptoms of ADHD, exploring alternative medications can help you find the best treatment option for your specific needs. Adderall, Vyvanse, Concerta, Strattera, and Intuniv are just a few examples of alternative options that may offer effective symptom management. Working closely with a healthcare professional specializing in ADHD is crucial in determining the most appropriate medication or treatment plan for your condition. By considering factors such as symptom management, safety, medical history, individual response, and treatment goals, you can collaborate with your healthcare provider to find the right solution that helps you effectively manage your ADHD symptoms and improve your overall quality of life. Remember, each individual's ADHD journey is unique, and finding the right medication may require some trial and error. With the guidance of a healthcare professional, you can explore alternative medications and treatments to find the best fit for your specific needs. Thanks for watching.